One of the potential complications of breast augmentation is called a capsular contracture. Whenever any synthetic device is implanted in someone, the body will form a scar tissue capsule around the object. The good news is that the scar tissue capsule can help hold the weight of a breast implant and thereby reduce the tendency to droop over time. However, in some women, for reasons we don't quite fully understand, the scar tissue capsule can shrink and squeeze the implant. We call this a capsular contracture. If this occurs, the breast will feel firmer and the implant typically takes on the form of a sphere. A capsular contracture can also change the shape and position of the breast implant. Typically, the implants are displaced upward. Factors that increase the risk of capsular contracture include trauma, infection, excessive blood or watery fluid, called a hematoma or a seroma, in the breast pocket, smoking, and radiation. To prevent capsular contractures, I use meticulous surgical technique to assure complete sterility and ensure that there is no bleeding at the end of every case. I also use powder-free gloves, antibiotic irrigation, and a no-touch technique, which means the implant never touches the skin or the surgical drapes. It is either in a sterile container or I am inserting it into the patient. I am the only one who ever touches the implant. Neither the scrub tech or the nurse touches the implant. The cleaner the implant, the less likely a capsular contracture will form. Also, my patients are instructed on how to do proper breast massages in order to further minimize the chance of capsular contractures. Oral vitamin E along with multivitamins has also been shown to be beneficial. Anti-asthma medicines such as Accolade or Singular have also been used with limited success. This would be considered an off-label use of these medications, which means the FDA does not have any formal recommendations to use these medications for capsular contractures. Therefore, I typically do not recommend Accolade or Singular because they offer limited benefit and have multiple side effects associated with them, including liver damage and possible death. Finally, textured implants may reduce the likelihood of capsular contractures, but some studies fail to show any benefit. I appreciate your interest in breast augmentation. If you need more information and want to speak to me or our patient coordinator, please do not hesitate to let us know. We are more than happy to discuss any of your questions or concerns. Thank you.